Each year, thousands of people are saying so long to wearing glasses and contacts and electing to have laser vision correction. But how safe is it, and how do you know if the procedure is right for you? Dr. Jeffrey Gold is a familiar face here on Connecticut Style. He's a board-certified and award-winning ophthalmologist and the owner of Liberty Vision. He's joined by his patient, Ralph Columbare. Welcome, gentlemen. Thank you for being here.
Thanks for having us.
Thank you.
So it's a fairly popular procedure, laser vision correction.
Right.
A lot of people are having it done each year.
Right. Actually, almost 1 million people in the United States alone
wow.
are having laser vision correction every year. And worldwide, it's something like 3 million.
And the satisfaction rate is through the roof.
Satisfaction rate is unbelievable. More than 95% of patients worldwide are satisfied, and 96% would do it again. We hear a lot about the safety of the procedure. I get a lot of questions about how safe is this really, and it's incredibly safe. And I think that we can observe that by the statistics of physicians who are having it done. I mean, physicians have the wherewithal to research these things from a different perspective than the general population, and yet physicians are having this done as well as their families. In 2014, there was a study that was done at the Cleveland Clinic at their Cole Eye Institute about the long-term follow-up of laser vision correction in physicians, about quality of life and patient satisfaction. And over a course of several years, they did the procedure for 132 doctors, 9 of whom were actually ophthalmologists. And of those 9 ophthalmologists, 8 were very satisfied, and the other one had dry eye, so he was uncomfortable. But in 7 of 8 of those, their uncorrected vision after surgery was better than their best corrected vision before surgery.
Oh, wow.
And all of them were better prepared to do the procedures that they do afterwards without having to deal with glasses or contact lenses.
Now, also there was, to continue with some statistics here, the Joint LASIK Study Task Force. Tell us about that.
This is from the world literature. Everything was pulled together, and 97% had the same or better best corrected vision after surgery, and 96% would have repeated it if they needed to. And in 2013, the International Society of Refractive Surgery, this is a group of doctors from around the world who does this kind of surgery, 40% of the responding ophthalmologists have had the procedure done. 34% of their spouses, 26% of their children, and this is really dramatic, 72% of the responding ophthalmologists, at least one of their siblings have had it done. I've personally done this for 2 of my siblings.
So obviously, if your family's going to undergo it, this is something that's very trustworthy, and those numbers were through the roof there.
Absolutely.
And let's talk a little bit about your practice, doctor. What's unique is that you do all of the preoperative testing yourself.
Right. In a lot of practices around, they're high-volume practices, and patients don't even get to meet the surgeon before the day of surgery. Whereas in my practice, the first person they meet is me, and I do their screening to determine whether they're candidates. I explain the procedure and give them their options. I have one assistant who does the custom scan, and the reason she does it is because she's better at it than I am. And then I obviously do the surgery, and I do all the postoperative care myself.
Very good. And Ralph, I want to bring you into the conversation. Tell me about your vision before you called Dr. Gold.
Well, I would wear glasses from morning to night. I just couldn't function without them. To put them on the nightstand at the end of the day, and pick them up in the beginning of the day, and it was just so intrusive. You'd get little marks on your nose, from the glasses.
That happens, right?
Forever and ever. And so my experience was that I wanted to change that somehow. How could I do it? And I actually watched Connecticut Style, and I was approaching
my. To hear that.
Oh, thank you. I was approaching my 66th birthday. I said, what could I do for myself? What could I make myself younger? I'm physically fit, healthy, but I wanted to do something. And after watching the show, I decided to go seek out Dr. Gold, ask him if I was a candidate, and he assured me I was, even though I had strong glasses. The prescription to my glasses were quite strong. And I said, I want to be sure I'm not a borderline candidate. I want to be the right candidate for this procedure. And he assured me that I would be able to do that, and we went ahead with the procedure.
Very good.
And Sometimes it takes longer based on your prescription and how you recover from this LASIK. And I was getting a little nervous. I was getting around the 8th
Whoa,
week.
you wouldn't have to be with
the 8th
Dr.
week.
Gold, right?
Well, I was asking him some questions, and I said, you know, I'm getting a little nervous. I want to see perfect. And he says, give it time.
And sure enough, how about today?
Actually, it's great, 2020.
Very good. Doctor, explain to us Epi-LASIK versus LASIK.
Okay, one thing more I want to say about Ralph is when he was nervous, and I get this with nervous patients, I say, if you don't see me looking nervous, you don't need to get
I
nervous.
guess that's a good indicator, right?
True.
Because I've done this 11,000 times, and I know what to expect after
Sure.
the procedures. And granted, some people take a little longer. Some people are 20/20 the next day. That's a rarity with Epi-LASIK. And the reason is that in LASIK surgery, I'll show you with this model, the cornea is cut open. And this part is called a flap, and this part is called the bed. This is where the laser correction happens, right in the bed. And then the flap goes back down. The edge seals overnight. But we now know for sure, since a study that appeared in 2011, that the flap to the bed never fully heals. So anybody who's had LASIK has to be careful not to get hit in the eye, because if they get hit just wrong and that flap comes loose, they've got 1 hour to find me to fix it, or they may need a corneal transplant.
Sure.
With Epi-LASIK, I think we have a graphic that shows the difference between LASIK and Epi-LASIK. But in Epi-LASIK, there's no flap cut. And you can see in the picture on the right, there's LASIK with the flap folded back. In the picture on the left, there's Epi-LASIK with just a thin sheet of cells from the surface that are pushed off with a device that works similar to, that white device is a blunt tip separator, and it works basically like a snowplow on your driveway, and it just uses physics to find the plane to push those cells off. They are thrown away, and then the laser changes the shape of the second layer down, and as those cells grow back over the next 3 to 6 days, the vision is there.
Very good. Doctor, we're just about out of time, but tell us about the special offer for Connecticut-style viewers, please.
Anybody who calls Liberty Vision and mentions this program will receive a $200 per eye discount from their procedure, and we've extended that to active duty and retired military and all first responders.
Very good. Well, let's put some information up on the screen if you'd like to get a hold of Dr. Gold at Liberty Vision. It's located in Hamden. You could visit libertyvision.net, or you can also find them on Facebook. I know that you're pretty active with social media, Doc.
We are.
Ralph, thank you so much for sharing your story with us.
Quite
And of course, you can find them online as well. And that'll do it. Thank you so much for being here.
Thank you.